Guyana is currently going through an outbreak of dengue fever. Nobody is talking about it. I haven't seen any posts from the Ministry of Health, and in fact, I could only find one article. This article from a few days ago in Kaichura News, but it only says that Guyana is on high alert because there's an outbreak of dengue in the Americas generally. Well, I want to tell you it's already here at our doorstep, and we are seeing an increase in numbers of dengue fever reported. I've spoken to people at a few labs, I've spoken to doctors, and I personally have known about 8 people within the last month that have contracted dengue fever. It's now in the news because I think we're obsessed as a country. We seem to be obsessed with not looking bad. Anything that makes us look bad or make the government look bad. This mosquito is not in the opposition party. I don't know. Even down to COVID, we were not getting updates as we were supposed to. There is severe underreporting of data in this country, and it's a problem that needs to change. But I'm here to tell you about dengue and how you might be able to keep yourself safe in this period. Now, I also think we had a slight uptick in COVID cases the other day, but that's for another discussion. Let's discuss this dengue outbreak here. So many people that come down with dengue first mistake it for a flu because symptoms set on, the onset of symptoms is a few days after the mosquito bites you. But you can start with a headache. Look at these symptoms here on this chart behind you. Eye pain, you get this terrible pain at the back of your eyes. As you could tell, I had dengue about 10 years ago. It's one of the worst experiences of my life, and I would not wish it on any of you. So when I noticed there was an uptick, I became very fearful. I am fearful of catching dengue a second time. If you've had dengue already in your life and you catch it a second time, you're more at risk for serious complications, and dengue can kill you. Okay, so if you got any of these symptoms, a combination of these symptoms, go and get yourself checked. Go to the hospital and get yourself checked at the lab. Get some blood work done, and they will be able to tell you, confirm whether you've got dengue and which type you've got, because there are a few types. So there's eye pain, there's a very high fever, you can get headache, you can get pain in the muscles, you can get nausea and vomiting, a rash, and the rash, it might present differently on your skin type. On my skin type, it presented as hyperpigmentation. I had a rash that came over my rib cage. It lasted, I think it was a couple months. I had those spots on my rib cage. It's terrifying. Okay, you feel delirious sometimes, and disoriented. You've got joint pain, bone pain. So there is no known cure for the dengue virus, which is transmitted by mosquitoes. However, there are symptomatic treatment. I also know someone that died from dengue after their second or third bout of it just 2 years ago. So this is more serious to me. On my right or left, as you might be reading this, severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, blood in vomit or stool, being very thirsty, pale and cold skin. These are all symptoms of severe dengue, and they normally come on. The onset of these symptoms is after the fever has gone away. So if you experience any of these symptoms, you need to get yourself medical attention. One important point to note is that acetaminophen or paracetamol is often used to control pain. So drugs like ibuprofen and aspirin are generally avoided because they can thin the blood and increase the risk of bleeding. There's mention of a vaccine as well, dengue, for people that have had it at least once and live in places where the disease is common, but I've never heard of that, and I'm still awaiting some release from the Ministry of Health on this current situation. Don't tell us that we are on high alert for a disease that's already here and spreading. And I guess it puts into perspective why there was a fogging machine around the area a few weeks ago. But it's the first time I've seen a mosquito foggy in almost 2 years. So I thought it was maybe, one of the things they were doing around local government election, and everybody was trying to garner some votes. So I was like, oh, maybe they just remember they had a fogger line around Dusty. But it seems people do know there's an outbreak, but we're trying to control it, control the news, as we're always so obsessed with doing, and we're keeping the truth from people. We need to stop doing that in the interest of public safety, and this is one of those instances. I don't know how you could look at this issue and say it's political. Whether you believe the mosquito belong to the opposition or the government, it doesn't matter, right? The mosquitoes don't discriminate. The virus within them does not discriminate. And the replication of the virus, the particular genome, the concentration, those are all variable based on temperature fluctuations and the number of temperature fluctuations in the day. It's quite fascinating, but I am willing to bet that it has something to do with this El Nino cycle that we're in. Okay, that is not, I don't have any data on that, but based on what I've read thus far, I think this increase, and we're seeing it across the Americas, may likely have something to do with the El Nino cycle. But release the information, let people know how to be safe. If you have receptacles in your yard, go and look around the place. If wherever you might have standing water, get rid of it. Okay, get rid of the places that mosquitoes are likely to lay their eggs and have larvae breeding. If you can clear your drains, make sure you have the drains around you cleared. You don't have any standing water, right? That's the most important thing where mosquito control is concerned. And the particular mosquitoes you need to look out for, I call them the day squito. You know, in Guyana we got the night squito and we have the day squito. So the day squito, that's not the scientific name, but those are the mosquitoes that tend to bite you in the day, right? Those are not the only ones that can transmit it, but that's the most common vector of transmission. So you look out, keep yourself safe in the day. It's not always the nighttime you have to look out for. You have to keep yourself protected in the day. If you live in an area with a lot of mosquitoes, perhaps close to the mangroves, then you might want to stock up on insect repellent, insect spray if you need to use a coil. I know there's certain types of coil are forbidden in Guyana because of the particulate risk, but make educated choices, keep yourself safe, keep your community safe, and start with looking at your immediate environment to see what you can do to decrease the risk from mosquitoes around you. So start with standing water. You got barrels and drums and stuff. Make sure you empty them out of water. Don't have standing water around the place, and chop down any bush around close to your house. Make sure that you're living in an environment that is as mosquito free as possible, and lobby your local government organ to do more fogging in your neighborhood. Okay, these are issues of public safety. So if you have any more to add to this that I have missed out, please let me know in the comments. But for now, stay safe, guys.